you ever wondered what it feels like to be trapped in a body that doesn't align with your innermost identity? To start, consider the story of Chaz Bono, a man who began life as a female, but whose journey of self-discovery led him to realize his true identity as a male. His transformation, marked by sex reassignment surgery and the legal change of his name, exemplifies the struggles and ultimate triumphs of individuals with gender dysphoria. So what exactly is gender dysphoria? It's a clinical condition where an individual experiences significant distress due to a strong desire to be of a different gender. However, it's essential to understand that not every transgender person experiences this distress, and those who do require professional diagnosis and treatment. Diagnosis of gender dysphoria is a process, a careful distinction from nonconformity to gender stereotypes. Psychologists use specific criteria to diagnose children, adolescents, and adults. The criteria revolve around a persistent incongruence between an individual's biological sex and their desired gender, with a duration of at least 6 months. In children, the criteria may include behaviors like cross-dressing, preferring toys typically associated with their gender identity, or adopting their desired gender in role play. They might also display a strong dislike of their sexual anatomy and express a desire for physical characteristics that match the gender they identify with. Adolescents and adults are diagnosed similarly, focusing on their need to physically appear or feel like the gender they identify with. This is often coupled with a desire to halt or alter the physical changes brought on by puberty. A persistent need to be treated as their identified gender, along with the distress caused by the incongruence, forms the core of the diagnosis. Once diagnosed, treatment options are tailored to individual needs, taking into account coexisting conditions such as depression and anxiety. There are 3 primary treatment options for gender dysphoria. The first is gender expression and role treatment, where individuals practice living in their desired gender role. This can be a crucial step towards alleviating distress and improving body satisfaction. The second option is hormone therapy, which aims to alter physical characteristics to align with the individual's gender identity. It involves prescribing feminizing or masculinizing hormones to induce changes such as breast development or facial hair growth. The third and most significant option is sexual reassignment surgery, a major decision that requires informed consent and well-documented dysphoria. This procedure changes primary and secondary sexual characteristics to align with the individual's gender identity. In conclusion, gender dysphoria is a complex condition marked by significant distress due to a mismatch between an individual's biological sex and gender identity. Diagnosis involves specific criteria and is distinct from nonconformity to gender stereotypes. Treatment is tailored to individual needs and may include gender expression and role treatment, hormone therapy, or sexual reassignment surgery. Understanding gender dysphoria is crucial to providing appropriate support and care for those affected, fostering a society that values and respects all forms of gender expression.